Okay. Ready to start it off now? Okay. So, hello everyone. Welcome to VSIG Discover Group's event on Introduction to Vascular Surgery. Thank you so much for joining us tonight on this special event. This panel is for any medical students who may be or are interested in pursuing vascular surgery, and we hope that we provide as much insight and helpful information for everyone. First, we would like to introduce the medical students on the advisory committee for VSIG. We would like to give a special shout out to Discover Group for helping us put together this panel and to Dr. Daniel Hahn for helping us organize this event. And now I would like to introduce our special guests for the panel tonight. May I ask Dr. Abai for an introduction, the institution that you're affiliated with, and how long you've been in practice for, please?
Hi, everyone. My name is Babak Abai. I'm one of the vascular surgeons at Thomas Jefferson University Hospital. I've been practicing vascular surgery for the past 18 years, probably somewhere around uh, 15 of it in academics and 3 years in private practice. I've been at Thomas Jefferson University for about 13 years now.
Thank you very much. Now I'd like to hand the mic over to Dr. Berland for an introduction and his affiliated institution and how long you've been in practice for.
Sure. Hi, guys. My name's Todd Berland, vascular surgery out of NYU here in Manhattan, in New York, of course. And I finished my fellowship in 2008. I did the 5 and 2, general surgery, followed by 2 years of vascular, because that's all that was available in 2008. Um, uh, it was very rare, I think, to have 0 5 at that point. But I've been in practice about 15, 16 years and at the same institution at NYU the whole time. So happy to be here and glad to field any questions and chat about vascular.
Thank you. Now I'd like to ask Dr. Young Lee for an introduction, the institution that you are affiliated with, and the duration of your practice, please.
Hi, everyone. My name is Young Lee. I am currently with Miami Vascular Specialists. We're a private practice group in Miami. My practice covers all of the Baptist hospitals. So it's a large health system in South Florida. We cover 5 different hospitals, and I am in my second year of practice. But I did train at an institution where we had both integrated vascular residents as well as early specialization program, which was one of my co-fellow where she did a 4 and 2, and I'm a traditional 5 and 2. So I have that experience as well.
Okay, thank you very much. Now I'd like to hand it over to Dr. Nakazawa for an introduction, his affiliated institution, and how long you've been in practice, please.
Hi, everyone. My name is Dr. Ken Nagazawa. I'm been in practice for about a year and a half now at Lenox Hill Hospital. I did my integrated vascular residency at Mount Sinai. Looking forward to working and speaking to all of you today about vascular surgery.
Okay, thank you, all panelists. Next slide, please. So, my name is Sung Woo Baek, or I go by William. I'm a third-year medical student from Rutgers Robert Wood Johnson Medical School.
And my name is Hiran Walia. I'm a second year medical student at PCOM.
And yeah, we're going to be hosting the panel today, along with our wonderful panelists. Next slide, please.
So, what is vascular surgery? So, vascular surgery is a rapidly developing field. It works on almost all parts of the body, operating mostly on the aorta, peripheral arteries, veins, lymphatics.
Okay, so I would like to first ask Dr. Abai what his day-to-day looks like as a vascular surgeon at Thomas Jefferson University, and also if you could please share with us which procedures you perform commonly in your practice.
My day-to-day practice varies. I mean, there are some days, 2 days a week, I'm in the operating room, doing a variety of operations. Typically, um, what I do is a mix of procedures. I really truly practice a full breadth of vascular surgery from fistulas to aortic work. And then about 2 days a week, I'm in the office, and in office hours, I do, I see patients, and I follow as you know, vascular surgeons see their patients long term. So a lot of my patients are recurring patients, and I also do some office-based venous office-based procedures. So my day-to-day work varies. There's some academics mixed in as well because we do quite a bit of research, as well as the program director of the Vascular Surgery Fellowship. So I have to, have some academic component or educational component to the whole thing.
Okay, thank you very much. And after, I would like to ask Dr. Berland for his day in life as a vascular surgeon at NYU, and also which procedures you perform commonly.
Great. No, thanks for asking. The great thing about vascular surgery is that you're all over the body with your operations and interventions, and you can have an office-based practice, you can see patients, you can do wound care. So the beauty is other specialties, I think, get pigeonholed into Mondays I do this, and Wednesdays, Thursdays, Fridays are this. I'm doing everything every day. And since we're kind of incentivized to be busy, I don't find myself doing like just office hours on one day. I mean, I saw 50 patients in the office yesterday, and we don't have any PAs or MPs. And I enjoy being busy like that, but I still do like one vein at the start of every hour. So 8 a.m., 9 a.m., 10 a.m., one vein, but then 50 patients all the way through. So this way, as patients are being roomed, I feel like I'm being productive by doing those vein procedures. I'll even start the day sometimes by doing like a main OR case before and then start all the office hours. I'm the director of outpatient vascular at NYU. So we created the OBL during Hurricane Sandy back in 2012. I'd only been out for about 2 years, but I knew I wanted an outpatient kind of practice. So we created the OBL for NYU, and I'm the director of that. And I think the future of vascular surgery is more and more to be done in the outpatient setting, which I don't hate the hospital, but it's so efficient and fun to be in the OBL. That's really where I like to be and where I'm happiest because of the efficiency. Everyone knows how inefficient the main OR is, and that just frustrates me and really stresses me out. So that's why when I have a main OR day, in between cases, I'm trying to do veins or see patients because there's just so much downtime with room turnover. Some people might like that. And if you have a purely academic practice, you may love it because you can make all your phone calls then, hang out, chit chat with the nurses and the staff, whatever you want to do. But I just get antsy doing that stuff. So I'd rather just be busy. So I've got no particular day that's just office hours or just OR. Every day is kind of a mixture of either. And I think that you kind of have your choice to make it what you want.
Thank you very much for that. Now I'd like to hand it over to Dr. Young Lee for her day-to-day as a vascular surgeon at the Miami Vascular Specialist Group. And as a private practice attending, I think a lot of students were also interested in asking which procedures you might also be commonly performing.
So we do have dedicated office days. So mine is Monday, so I start my week off. But every Monday, I am only in office. I'm only seeing patients. That's all I do. The rest of the week, Tuesday through Friday, are my operative days. I operate every day. We do cover 5 hospitals, so there's quite a bit of going between the hospitals. But generally, at most, I'll probably just go to 2 hospitals a day. Usually, they stay at one location. And we cover all the inpatient and outpatients at that location for the day. Our my most so our practice is about 50% dialysis access, and the other 50% is completely diverse. As Dr. Berlin mentioned, where you cover so many varieties of procedures. So we do everything from endovascular interventions to veins to also quite a bit of open surgery. I have a lot of people in my group who still do a lot of open aortas. I have one partner who does like open cable reconstructions with surgical oncology, things like that. And then we don't have an OBL, but we do participate in an outpatient dialysis access center. So at least one day a week, going there doing all dialysis access work, endovascular. So That's how my day goes.
Thank you. Appreciate that. And last but not least, I would also like to ask Dr. Nakazawa for his day-to-day as a vascular surgeon at Lenox Hill, and also which procedures you perform commonly.
Yeah, I would say generally, I have clinic 2 days a week, Mondays and Wednesdays, and I operate Tuesdays, Thursdays, and Fridays, both in the OR and in the cath lab. But a lot of times, the schedule can be unpredictable, especially when you're on call. And when I'm on call, I have to sometimes help out other surgeons, such as in CT surgery with, um, ECMO, decannulations, other disasters, you know, um, other surgeons needing help, TAVR cut downs, et cetera. So when you're on call, sometimes it can be unpredictable. That's sort of the fun aspect of vascular surgery. In terms of my most common procedures, I think for elective wise, it's mostly PAD work and dialysis access for my elective cases and some carotids as well. But when you're on call, anything can come through. So be prepared for everything.
All right. Thank you.
So next, we'd like to ask our panelists why they chose vascular surgery. So we'd actually like to start with Dr. Nakazawa on this one.
Yeah, I mean, I think it's for me, it started with early exposure during medical school and the great mentorship that I had at Mount Sinai. And oftentimes, it's some things are by chance. And I think for me, I had a great experience my first time in the operating room with a vascular surgeon. I sort of clinged to that. I did some research in my, summertime during medical school. I just fell in love with all the procedures that we get to do, operate all parts of the body. And it just really made sense to me. And I think as you guys go through your third and fourth year, you'll rule out certain specialties that you initially were interested in. And vascular surgery, which is a wide variety of procedures, helping out sick patients. And the longitudinal care was very appealing as well.
Thank you. Next, we'd like to ask Dr. Lee why she chose vascular surgery.
My journey was a little bit interesting. I didn't decide until well into my third year of general surgery residency to do vascular surgery. Actually, when I started general surgery residency, vascular was at the very bottom of my list. But I had a really wise mentor at the time who pointed out the fact that it's really hard when you're an intern and you're mainly doing all the wound care and dealing with the inpatients who are the sickest and the most disaster cases to like really appreciate the art of vascular surgery, especially when you're not in the OR as much. But with time, as I started to participate more in the OR, I like the variety of surgeries. I like that we are the one specialty that is not afraid of hemorrhage, bleeding, the things that other people always call us about. So I find that vascular surgeons tend to have um, a, I would say like a confidence that I don't see in all surgical specialties, and I enjoyed that. As well as every vascular surgeon I've worked with have always been among the most technically skilled surgeons, and I wanted to be part of that group. I also like that intimate relationship with your patients where they're your patients for a lifetime. So I do develop and really work on honing those relationship with my patients. And that is one of the things I really enjoy the most.
Great answer. Thank you so much. Next is Dr. Berland. Why did you choose
Sure.
vascular surgery?
Yeah, I mean, I echo what they said. Those are all great answers. I also have to say, I grew up, I'm part of the Atari, Nintendo kind of video game generation. So the aspect of the endovascular really drew me. You might find your surgery colleagues hating endovascular. And if you're not into it and you're the third person in the room, you're just pinning that wire and maybe getting yelled at for it. But the endovascular part, when you're doing it, to me, is like a video game. That's the fun stuff. I went into vascular surgery because of the tech involved with the specialty more than any other specialty. We've got cool imaging, different techniques, 3D things, and then we've got thrombectomy devices, different kinds of stents, balloons, all kinds of things. And then the pipeline is 10 times bigger than that. So there's just so many cool things from a tech and device standpoint, that kind of drew me. And then the need for vascular surgeons. I wanted to be a cardiac surgeon. And my mentor said, don't go into cardiac. We're going to be out of business in 20 years. Cardiologists are putting us out of business. Go into vascular, where you can do the stents and do open surgery. Plus, the baby boomers are all getting older, and they're going to all need vascular surgery. So it's more like job security. They're always going to need vascular surgery to fix holes that other doctors put in arteries, and then to open up clogged arteries from the aging population. So I feel like there's lots of reasons to go into vascular, but for me, it was the tech and the job security with the baby boomers getting older.
Thank you, Dr. Berlin. Next is Dr. Abai. Why did you choose vascular surgery?
Well, I got into vascular surgery in a roundabout way as well. When I was a medical student, I actually wanted to become a neurosurgeon. And initially, I didn't match into neurosurgery. So I did general surgery. And as I was doing general surgery, I would scrub into all kinds of cases, and vascular surgery came into under my radar. Initially, I must say that what attracted me to vascular surgery was all the big open procedures, even the smaller ones, the bypasses, the carotid endarterectomies, the aortic work, the open aortic work. That's what attracted me. And since, the beginning, you know, since when we trained, up to now, vascular surgery has significantly changed, and we do a lot more endovascular, and we do very complex endovascular procedures these days. So, initially it might not seem as interesting, the endovascular stuff, but technically it's very challenging and exciting, as Dr. Berland mentioned. So, the more I practice, the more challenging I find, the more things like PMEGs. We do laser fenestrations, all kinds of things that I truly didn't train in. So I find it exciting that I'm doing procedures that I never trained to do. It's a field that is evolving and exciting, so I'm lucky to be a part of it.
Thank you, Dr. Abai. Moving on, we're going to move on to frequently asked questions. So we've briefly talked about this, but how do you see vascular surgery evolving in the future? And we'd like to start with you, Dr. Abai.
Well, I think vascular surgery has slowly evolved from an open practice to a mixed endovascular open practice. And there's always all these innovations and new techniques. For example, I used to do a lot of open thrombectomies, but as time went on, we now use a lot of endovascular thrombectomy devices to take clots off in the legs or even in the bowel. We've started doing SMA endovascular thrombectomy. So, it's an evolving field.
Thank you for that. Next is Dr. Berland.
I mean, I'm a little biased here, but I think that the vascular world is going outpatient, and more of what we do is going to be done in the outpatient setting. Within the next 3 to 5 years, you're going to have codes for simple carotids and simple aneurysms to be done in the outpatient setting. The motivation for this is that hospitals are getting busier and busier. And there's this term called contribution margin. That's how much a doctor contributes to the bottom line of a hospital. And the hospitals love vascular surgeons because we deal with all the emergencies. We prevent lots of lawsuits from when those other surgeons get into bleeding and nick the popliteal artery during a knee, or, the femoral artery during a hip. We're getting called in for all of these, which is great. But when you look at some of these complex endovascular procedures, while they do pay the hospital sum of money, they are very costly. These grafts are 20, 30, $50,000 for these complicated grafts. So the contribution margin of a vascular surgeon to a hospital is less than, say, a neurosurgeon or a cardiac surgeon. So you don't get the same love, in my opinion. So there's a motivation to move our specialty outside of the hospital where they are more, where they do pay more and cost less to do. So in the next 3 to 5 years, you're going to see a big push for vascular to go into the outpatient space, which is great if you love that kind of pace. But the inpatient vascular is always going to be there too. There's still going to always be big, open, complicated things to do. And there's also going to be emergencies that you have to jump on. So I think that the future is looking good for vascular. I just think it's going to really shift towards outpatient to decant the OR to get higher contribution margin cases, an open appy, an open gallbladder. The hospital makes more off of that than an aneurysm. So they want the aneurysm patients treated, but they want it in a very efficient way, and they want the ORs to be used for high contribution margin cases. That's my opinion.
Next is Dr. Lee.
I mean, I agree with both of our panelists who just spoke before me. I do see that more and more procedures of vascular surgery becoming more and more outpatient. I definitely agree with that. And especially with more OVLs and ASCs coming up, and I see more ambulatory surgical centers becoming a thing, that's where it's headed. But definitely our role will still also be maintained inpatient because there are actually a lot of vascular surgery emergencies that need to be handled by us that other specialty can't do. And I see that especially in covering like all the different hospitals that we do. So I still see a significant role like within an inpatient setting.
I think you cut out towards the end, just like the last part. Okay, all good. Um, Next is Dr. Nakazawa.
Yeah, it's a great question. Sort of unpredictable, but some things that I've noticed. I know people talking about robotic vascular surgery. I know Dr. Lumsden's been talking about that. I didn't train in robotics, but that's definitely an area that's I think gaining a lot of traction. And along the same lines, things that are more minimally invasive, better stent grafts, going into the arch, which already exists, but I think the techniques of that will continue to get better. Another topic of interest for some people is, you know, a lot of endovascular work is using less radiation. So I know the technology exists already, but becoming more mainstream in that aspect and reducing the radiation is something that will continue to evolve as well. But as the other panelists have mentioned, I think at its core, vascular surgery, as vascular surgeons, we will have to deal with emergencies, and those bread and butter standard techniques will always be there for us to solve these emergency situations. And so that aspect, I don't think will change much. But in terms of these complex problems, hopefully the technology continues to get better.
Okay, I really appreciate your honest responses to all the panelists. So this is actually one of the most frequently asked questions that as it is kind of on our interest. On behalf of a lot of students interested in trying out or pursuing vascular surgery, actually we would like to first start out with Dr. Nakazawa this time on how they can gain more exposure or how to get involved in vascular surgery.
Yeah, I would say I would reach out to your the vascular surgeon at your institution and try to scrub in as many cases as possible. Um, Medical school is not that long, and this is a very important decision for all of you, and you don't really have much time. So, I would say try to do as many rotations, electives as possible, scrub as many cases as possible. Just you see the whole breadth of vascular surgery, and if it's not for you, that's totally fine, and it's better to rule that out as soon as possible. But the way you really know that vascular is for you, I think, is to be in the operating room, see all these different cases, all the complications. Um, and I think that's what I would recommend.
Okay, thank you. And we'd also like to ask Dr. Lee for her take.
Definitely try to gain as much or experience and exposure as possible. I think as vascular surgeons, we're always excited to educate and show our next generation of vascular surgeons what we do and to involve them in what we do. But I also think there is an aspect of vascular surgery that isn't present in all of the different specialties. And this is one of the reasons that got me interested in it is if you do an interesting case with a vascular surgeon and you're on that service or you're rotating in the hospital and you have the opportunity to maybe see some of the outcomes of the surgeries like in an office setting, I think that's also super valuable because that is what actually affirmed my decision in wanting to go into this field. So to see the product, because when you see these patients in the hospital and inpatient, they're really struggling. And so you don't necessarily see how significantly their life can be changed by a good revascularization procedure or, other things we do. So I think that's also something that you should definitely be able to experience so that you understand the full scope of like what you're doing. Also, if you're working with a vascular surgeon who also does work like outpatient work at an OBL or veins in a clinic, you should also try to participate in that as well because again, as vascular surgeons, you're not just tied to a hospital. So that way you can see like all the different options of what this career can offer you.
Thank you very much. And continuing with that outpatient proponent of and I apologize in advance that the answers are kind of getting harder and harder to answer to come up with. So
Yeah, actually, it's not for this one. And I totally agree with what both of them said. If you don't know you want to do vascular, you've got to get exposed so you could make that decision and decide that you want to do it. But if you realize and come and see the light that vascular is awesome and there's no regrets, at least on my end, and I highly recommend this as a specialty, I think you should focus on everything but vascular surgery. Take this time in med school during your pediatric rotation to be a pediatrician. Learn everything because you're never going to go back and look at that again. I promise you. Same thing with your internal medicine rotation, OBGYN, ER. On each of those rotations, be the ER doc, be the OBGYN. Learn as much as you can because you're never, ever going to look at that stuff again. And throughout your life as a vascular surgeon, your friends, your family members are going to look at you as the doctor and they're going to ask you those OBGYN questions and those pediatric questions because they trust you as a vascular surgeon knows all this stuff. So I say focus on, if you know you want vascular, focus on everything else right now that got you here and that's going to make you an MD or a DO, and you'll have plenty of time in your whole career to learn vascular surgery.
I appreciate that. Thank you. And last but not least, Dr. Abai's perspective.
No, I truly agree with Dr. Boland that you should in each of your rotations really put everything into it because each rotation that you do as a medical student exposes you to a variety of fields and medicine. But when you decide that you like vascular surgery enough, I think you should also have a sort of a game plan as to how to get accepted into a vascular surgery program. And we're fortunate enough that we will talk very shortly about the two pathways. But if you want to do vascular surgery and you want to get accepted into vascular surgery as a student, you have to be competitive. So first, grades matter a lot. So make sure you have good grades. It's very competitive. Make sure that USMLE scores are very good. And lastly, it's a good idea to find a mentor, a research mentor, and do some research in the field. I think buffing up your application never hurts. And research involves, doing research, going to regional, national, or local meetings, presenting, and as well as publishing in major journals. So if you're really interested in going as a student, that's the pathway you would take. And if you're really focused in vascular surgery, and you don't get in as a student. I always tell the students there's a second pathway. You can do a general surgery residency and then get into vascular surgery. But it is an exciting field, I think.
Thank you. Appreciate that. Next slide, please. So, piggybacking on the numbers are supposed to show here, but oh, there we go. Okay. So yeah, piggybacking on Dr. Abai's comment on the two pathways. So this is kind of an intro for most of the medical students who are coming in and learning about vascular surgery. So there are two pathways to becoming a vascular surgeon as a medical student. The first is in an integrated pathway where you train for 5 years, rotating through general service and vascular services, often with the last 2 years focused on vascular surgery exclusively at most institutions. There are a total about 79 integrated programs, the last I checked, in the country per the NRMP data. And there is the fellowship pathway where you finish your general surgery residency first in 5 years and apply to a 2-year fellowship program in vascular surgery. So there are approximately about 118 vascular surgery fellowship programs available in the country. Okay.
Sorry, I just wanted to add there is one more pathway, and I think a handful of programs in the country have it, including where I trained at Emory. It's called early specialization. So you do go into the general surgery pathway, but if you know pretty early on in your general surgery residency and you're at an institution that offers this, you do have a chance to complete your general surgery residency in 4 years, be fully eligible for general surgery boards, and transition into a fellowship after 4 years of general surgery residency. So it's a 6-year program. And one of my co-fellows was a pilot at our institution for that.
Thank you. Just to clarify, what is that the one that you get certified in both general surgery and vascular surgery?
Yes. So essentially, as a PGY4, you do all of your chief cases. And if you meet all the requirements of general surgery residency within that year and do all your chief level cases and meet those numbers, then you are eligible to sit for the general surgery boards after 4 years of residency. And then you can transition into your fellowship program. And generally to do that, like they keep the residents to the fellowship transition in-house.
Yeah, thank you for that. Apologies for leaving that out. So the next slide is so actually so I just want to take the time to introduce who we are as VSIG. And for those of you who may not be familiar with our organization, it was started as a national forum for students who are interested in vascular surgery to participate in by students specifically focusing on those who are at institutions with no home vascular surgery interest group to receive continued vascular surgery exposure and mentorship. So our Discover series aims to reach students in their first and second years to foster interest in the field. And these are some of the photographs that I put together, and we run through journal clubs and meet at conferences and get to know each other. Okay, so yeah, so before we close out the whole panel, so I just kind of wanted to open the floor for the students who were able to make it today. If they have any questions for any of the attendings here, please feel free to ask. Yes, Dr. Han.
Yeah, thank you very much to all the panelists for joining tonight and sharing a lot of the insights. I think for the medical students who are attending, if one of the things is clear for sure is that there are so many different paths that you can take in vascular surgery. We say, what a career in vascular surgery looks like, but it looks very different for a lot of different people. Some people are purely hospital-based. Some people are more outpatient-based. Some people only do emergency. Some people only do elective. But really, people kind of end up doing a mix of everything. And I think some of the voices that you heard from the panelists are that there's a lot of variety in vascular surgery. So for example, if you go into a specialty like neurosurgery, oftentimes you're focusing in on 1 to 2 or 3 procedures that you're perfecting throughout the career, the entirety of your career. For vascular surgery, you kind of have a big diversity in the kind of cases that you're doing and you're operating throughout the body, which is always interesting. I did have a question for the panelists because whenever I talk to medical students at my own institution, one of the things that always comes up, because we do talk about endovascular, and you heard from all of you guys, endovascular is a big part of vascular surgery, is competition from other specialties. Interventional radiology now is a straight direct program. Interventional cardiology as they're pursuing their own independent board. What do you think about specialty creep, competition in the endovascular space? Is this a danger for vascular surgery in the future? Would you pick something else if you're a medical student at this point? I think it's worthwhile to kind of discuss. And I guess whoever, I feel like we can always start with Todd.
Can I take a stab at that?
Of course.
Thanks, Dan. And first of all, thanks to Dr. Hahn for putting this all together and for kind of spearheading this years ago when you did. To those out there, obviously, this is, Dan Hahn did a lot for this. But let me also say, Dan Hahn is a vascular surgeon who is half a mile from my hospital, and I've never once saw him as competition. And as vascular surgeons, we're really not in competition with each other. To Dr. Hahn's point, our competition, unfortunately, really is the cardiologists who we accuse of doing unindicated procedures, interventional radiologists. There's a lot of different people that are doing the same things that we do. We always selfishly think that we do them better. And so I have more competition with the interventional cardiologist at my own institution than I do with a vascular surgeon at Mount Sinai. So I'll leave it at that, saying that our specialty needs to protect itself from that. We are outnumbered by cardiologists. They outnumber us 10 to 1. And they've got a very aggressive lobbying machine. So as vascular surgeons, we're a small, very specialized specialty. And I think our strength is when we stick together and when we're not in competition with each other.
I absolutely agree with that too. We have an interesting setup at my practice where in two of our hospitals that we cover, we fully do our own endovascular work, but at the main Baptist hospital, since the 1980s, the interventional radiology group has had a very strong hold in endovascular, and they're pretty dominant there. Now, I think the tides are slowly changing, and I won't get into the nitty-gritty of that because it's not finalized yet, but it does bring to light that like everyone is very territorial. So it's very important when you're outnumbered by interventional radiologists or by interventional cardiologists, because they're generally a much larger group, that we stick together and to show the hospital like your value in what you do, i.e., hey, all these specialties can do all these things, but we're the ones who take care of their emergencies. We're the ones who take care of when something goes wrong and things need to be opened up and et cetera. So I think it's important to, whether it's through the societies that we all stick together or, eventually try to create better lobbying groups like cardiologists. I'm married to one, so I know how strong their field is actually collectively, and how much more of a voice they have. I think it's really important to also stay in tune with technology and evolving technology and to stay in the forefront of it so that you do not lose that aspect of the specialty, because endovascular is a large part of our specialty, and to stay in the forefront of that in order to not fall behind and get excluded or phased out.
Yeah, I've been very fortunate in my institution. We haven't, interventional radiology and cardiology don't really do much peripheral work. They do some, but as a young attending, I've sort of used this as an opportunity to work closely with them to collaborate on some cases. And, I've had a good relationship with them. And, I've seen that in other institutions as well with interventional radiology and cardiology working well with vascular surgery. So there's definitely an opportunity for all of us to work together. And when that happens, I think good things can happen as well.
But definitely, I think there are many more cardiologists and interventional radiologists. However, they don't possess the double skill set that vascular surgeons have. In fact, what happens when an interventional radiologist gets in trouble? They call vascular surgery. What happens when a cardiologist interventional cardiologist gets in trouble? They call vascular surgery. So We're and it's not just these two specialties. What happens when orthopedics gets in trouble with bleeding or some other specialty? We're really the firefighters of the hospital, and we do you know the when you're a student, medical student, you see the ER doc coming and saving the day, but in reality, a lot of times it's the vascular surgeon who comes in and saves the day when other surgeons or other interventionalists are in trouble. But I agree there is some competition going on. The other point that I want to bring across is that there is a shortage of vascular surgeons. Every fellow that I graduate gets interviewed at 6 or 7 places, and a lot of these spots go unfilled. So there's a lot of job security in terms of when you're done. And there's also places in the United States that are vascular deserts where there are no vascular surgeons. And as a specialty, I think we need to pay attention to that, and as those in those places, cardiologists and interventional radiologists have taken over some of the endovascular portion of the treatments.
Thank you all. I just want to remind the med students again, if they had any questions, now is the time.
You could always type it in if you feel shy about asking it, and William will ask it.
Mohit has a question.
Yeah, hey, thank you everyone for organizing this great panel. I think it was very informative. The question I had was about integrated vascular residencies and the program structures. So I've noticed that some programs have required research years, whereas others don't. I was curious about what doors get opened or closed depending on which program you go to, whether it's one with research years and without, and if it's possible to still do academic vascular surgery without going to a program that has research years.
Yeah, I could just quickly talk on that. That's really a great question. I think if you don't feel like you're getting enough research, then it's so competitive, the specialty, where it seems like it's off the charts with the scores and the involvement and the volunteer work and the publication. So if you feel like you're behind on that, I would do the extra year. But if you're able to get that during med school and get the number of publications, I would just apply. We're an academic medical center, and the general surgery has the residents go out for 2 years to get an MBA or do research, but the vascular is the 05 is just straight through. That being said, if you want to, we've had a couple 05 residents leave and go get an MBA, which I think is the smartest thing you could do. But I don't think you necessarily need to do that for research. And you could get into academic medicine with just the application you're going to have from med school going into vascular surgery. You'll be able to go right into academic vascular if that's what you want.
Yeah, I think Mohit, that was a really good question, though. I think academics is different from place to place. There's academic that's research oriented and research that is basic science oriented and clinical oriented. If the goal of your academic career is one of these research, especially the basic science side, the additional research years are very helpful because in order for you to apply for your T32 grants and your R01 grants in the future, you need some background of being able to do research with some results. And that's what these programs during the 1 to 2 years helps you gain accomplishment for. Now, if your academic career is in teaching and education and things like this, you don't necessarily need the additional years to build that. And I think that would be the biggest difference between the research programs. There are some like programs that are major powerhouses for research. Like Michigan comes to mind that always does like 2 years of mandated research, but their residents are always getting kind of awards in their Dr. Gallagher's lab. And there's a couple ones that are really famous within vascular surgery. If that's your goal, the 2 years is absolutely mandatory. Outside of that, to Dr. Berland's point, you don't necessarily need the research years.
That's very helpful. Thank you.
We're just gonna give it a few seconds before we move on. Getting all my interview questions stolen today, but
I don't think we are as rich as cardiologists. I can tell you that.
You know, I will tell you this, that rich is different for different people. Um, you could be rich and having career satisfaction. I think vascular surgery will provide that. You could be um, rich and having taken care of patients and providing value to the hospital. Um, certainly you are not going to be starving as a vascular surgeon. I'll give you that. We do make good money, maybe not as much as cardiologists, as Dr. Young pointed out, but we do make good money, and I think it is a good field to go into.
Listen, I mean, rich is, we're talking monetary. All get the good stuff. You're going to be a doctor. You're going to take care of patients. You're going to get that good feeling, nachas, we call it Hebrew word for feeling good about doing good stuff. But yeah, the money's there, and the money's really in the outpatient procedures. Vein work still pays. You can do veins 4 days a week, nothing but veins, and make $1 million a year and have 3-day weekends. You can do that and not take care of any emergencies and not do any aneurysms. You can also have an OBL practice and do very well with that too. You can't do distal tibial bypasses on Medicaid patients all day long and make $1 million. Like, it's all going to come down to your patient mix, where you're operating, what city you're in, what kind of, are you taking care of patients with commercial insurance or with managed Medicaid? And so there's a lot of factors that go into it. There's some people that spent their whole career just kind of doing what they think is right and doing those bypasses on the patients at the underserved hospitals. And you're going to do okay, even doing that. You may not be rich, but you're still going to do okay, even doing that. But the one thing vascular gives you is that opportunity to do all that stuff, but then also have a half a day of veins and do a couple of veins here and there and do some outpatient procedures. You don't have to do all of those things, but you could do a combination of those distal bypasses on the underserved patients population and also do some veins on commercially insured patients and live a great life from a monetary standpoint.
I love asking all of you guys this because I know a lot of the times the medical students don't want to ask about salary and things like this. And forever, vascular surgery was missing from like the AAMC salary data. Like, when you look up specialties and how much people make, I'm guilty of it. I looked it up when I was a medical student to see what specialty I got to pick to make $1 million. And you see neurosurgery, plastic surgery always kind of mentioned within it. I'm happy to report that vascular surgery is now included in some of the more recent surveys. And you'll see vascular surgeons do get reimbursed quite well. And I think out of the surgical subspecialties, I think we're above ENT on the national, average. And I think we come around the fourth or something like that. But that's not publicly available data. And to Dr. Burnland and Dr. Lee and everyone's point, actually, there are avenues in every specialty. Well, not every, but most specialties to make $1 bazillion. You set up a highly efficient outpatient practice that sees a lot of patients. You have the potential to do that as a vascular surgeon. Most people don't set that up as a first day, vascular surgery attending. But I will tell you, we are graduating 4 vascular surgeons this year from our program, and the lowest salary that anyone has gotten from the graduating group is $450,000, and and the person who's getting the most is $750,000 as a first year attending coming out, which I wish I got that when I graduated. But like nowadays, like the salaries for vascular surgeons are highly competitive and very good. And it's these practices that have these guaranteed salaries for like 2 to 3 years. I think, when we think about job security and being rich, I think it's a good stepping stone. And then from there, it's based on what you build. But thank you all. I think it was a great event. Real props to Hiram and William for putting together a really good event tonight.
Thank you very much. Thank you so much again to everyone who joined us tonight. If you'd like to learn more about our events, would like to become involved in InvestVC, please email us at the email address listed on the screen. We're always excited about new members joining. And finally, thank you so much to our panelists for your time tonight. We really appreciate you speaking with us today and all of your honest responses in the midst of your busy schedule. Very grateful for your thoughts and advice. And here's to leave you with a joke. All right. Thank you, everybody.
Thank you.
Thanks, guys. Appreciate it.
Thank you.
For having
Bye-bye.
me.